Well, hello there. It's Dr. Brian McKay, Core Health in Darien. My podcast, Not Just a Chiropractor for Stamford, Darien, Norwalk, New Canaan. The reason I have such a strange name for my podcast is that this is the areas I serve. So that's why I have it in there. So people can find me as well and hopefully learn from what I have to share. Okay, herniated disc versus bulging disc. Very, very similar, but here's the issue. A herniated disc is more severe, I would say, and a bulging disc is a minor herniated disc. Okay, and when you think about an egg, okay, you crack the egg. The white part is the outer, harder part, and the yellow part is the cushy, softer, more malleable inner part, and that's kind of what your disc looks like, but harder because it's cartilaginous. You have a hard outer shell to the outer layer, or the annulus fibrosis, if you really need to know the technical term. And then the inside is that soft, cushiony disc material that helps absorb the shock. The disc is important because it separates the bones and allows for mechanical efficiency and movement. So when the disc gets herniated, it's usually due to external pressure placed on the bone, placed on the bone because the muscles are in spasm. So a lot of times people say, I have a muscle spasm caused my low back pain. You take an MRI and you find out you have a bulging or herniated disc. Not a good scenario, but what can you do? So I'm going to tell you what you can do. First of all, here's the symptoms. You can have sharp shooting pain and herniated disc. You can have no pain and have a wicked herniated disc. I mean, MRI studies have shown that you can be totally asymptomatic pain-wise. The delicate nerves that exit the spine, each spinal level is 26 openings. They're called intervertebral foramen. And what happens with there is you have not, it's kind of a cable. It's not just one wire. It's a cable. It's 9 different things. Only 2 out of 9 deal with pain. That's important to think about because pain is the main motivator for people to come in and get treatment. But you can have numbness, tingling. You can have muscle wasting. You can have problems with your knees because the nerve that goes from your back goes to the knee, and that's a big issue. So the nerves that come out your lower back typically can cause you a lot of problems that are not pain wise. So you take an Advil, you got a little discomfort, you take an Advil, you're still going to have weakness and stuff like that. So that's it's important to address these things because just because you have no pain doesn't mean you have a problem, and just because you have a positive MRI doesn't mean you have pain. Question is, how do you really treat it? All right, Core Health Darien. We've been doing this for many years. I'm out of school 30 years. I might be sound like I'm a relic. I guess in some cases I am, or a dinosaur. Titles that title doesn't bother me. But what we do is we've learned how to really effectively treat it. You know, you go the non-steroidal route. You're going to get out of pain. You will get out of pain pretty much, or you take a cortisone shot, you're going to get out of pain. But are you going to fix the underlying problem? And again, I wanted to stress the autonomic nerves in the body control everything you don't think about, from scratching your nose to, you know, every function in your body, digesting food, teardrops, every single, the autonomic nervous system controls everything. And those nerves exit the spine. So if you have pressure on the nerve, it may not cause you pain because only 2 out of 9 are going to cause pain. You can have loss of blood flow. Um, so again, that's an autonomic function because you need blood flow to the muscles. So you can have weak muscles in the leg. You can have numbness, tingling. If you're a guy, you got to be really careful because if you have a chronic herniated disc, there's a correlation between that and erectile dysfunction. FYI, we don't treat erectile dysfunction here, but you ought to know what these things, the possibilities. So it's not just pain, okay? Pain's your motivator for walking in. I get it. It's not the right thing to treat it. So chiropractor first. You need to adjust the vertebra. It's called an adjustment. So we address the bone that's offending the disc or the several bones that are offending the disc. We remove the pressure off the disc that way. Now, the muscles that attach to the bone probably need a little bit of physical therapy. The soft tissue, you could do ultrasound. Really, I don't see people using ultrasound much anymore. It's kind of an antiquated thing. Next thing you can do is you can use EPAT, with extracorporeal shockwave therapy. This is called shockwave. If you have a chronic low back pain due to a herniated disc, you're going to have muscles that are very, very tight. And what happens is you can get in there with the shockwave and break up the adhesions. Adhesions form in the covering on the muscle, and they limit your mobility and will cause you pain because the fascia, which is the covering, fasciitis. Like if you heard of plantar fasciitis, it's painful muscle fascia on the foot lower part of your foot surface. Anyhow, you can break up the adhesions and stimulate blood flow to the muscles. And there's a lot of little muscles in the back that need that. I mean, specifically, I would call a multifidus, which is a rotator in the spine. Also, the quadratus lumborum with a QL, big muscle, and a lot of pain is involved with that. So when these muscles become dysfunctional, you got to stimulate them. And the extracorporeal shock wave, or EPAT, um, is a very, very viable way to do it very quickly. And it breaks up adhesions. And then the muscle kind of goes back to a normal covering without these pocks in it. And you allow for greater mobility and therefore less pain. So you have to address the muscle. Also, do muscle stim. Of course, there's exercise. If you're thinking you get away with a back pain, not doing exercises, it's a remedy for failure down the road. And a lot of people just once they're out of pain, they stop doing the stretches, the exercise you give them, and that's not a great thing to happen. More importantly, to wrap it all up, is once you take the pressure off the muscle, you rebalance the muscles, you get them working properly, you get the bone back where it needs to be, and now you have a better working scenario. Now comes time to heal the disc. And one of the most effective treatments is non-surgical spinal decompression. It's been around for 25 years. Again, we've been doing it for 25 years, so we have a fair amount of experience with it. So what it does is it reduces a disc is herniated. It's going to kind of like, think of a sponge. You push the water out, you squeeze the water out, and you lose the cushioning effect. Well, what happens here is the machine, the decompression machine, will move you and open up the joint, the spinal joint, and allow for the cerebrospinal fluid to come in. And when it does so, you now have a chance for the fluid to rehydrate the disc and kind of get back to normal confines. So here's how you want to think about that. Next time you're brushing your teeth, hopefully twice a day, you squeeze toothpaste out onto the brush, and there's a little bit of toothpaste out of the tube. You release the pressure on the tube, and the toothpaste goes back into the tube, that little dab remaining. That's how spinal decompression works. So if you want a complete healing of your herniated disc, chiropractor to adjust it and remove the bony pressure. It's physical therapy in the form of either EPAT, shockwave, laser, muscle stim to work the muscles. Home exercises, very important because it's very expensive to do exercises in the office here, and they're not as effective if you're not going to do them on a regular basis. So you're much better off having a home exercise program that correlates to your area that's affected. Well, listen, it's good to do exercises, period. Then we do a spinal decompression. You get your life back. You get out of chronic pain, and you feel years younger. Extra added benefit is you sleep like a baby. You get that back working properly, and you will feel a lot better. All right, I'm Dr. Brian McKay, Core Health Darien, serving Norwalk, Darien, New Canaan, and Stamford in the Connecticut area. Our phone number, 203-656-3636. Give us a call if you got questions. If you like this, well, come back for more. There'll be plenty more. I'm talking today about herniated discs. And if you have any questions, give us a call. Thanks very much. Have a great day.